Hello everyone, I'm Dr. Amit
And I'm Man.
and we are going to talk about the coronavirus.
What is the coronavirus?
Well, it is a virus which is named for the crown-like spikes on their surfaces.
There are four main subgroupings of coronavirus: Alpha, Beta, Gamma, and Delta. How did it all start?
Well, the epicenter of this virus was from Wuhan in China, where it was first identified. And since then it has spread like wildfire all across the globe.
How many people have been infected so far?
A total of 100,000 confirmed cases have been reported globally so far. And do you know how many deaths among these?
Well, about 3,200 deaths have been reported to date, with a fatality rate of 3.2%.
Gosh, that is a lot, isn't it? Let's compare this with the MERS, SARS and the Ebola viruses which had recent outbreaks.
The SARS virus, which was in 2002, had 8,098 cases and 774 deaths, which has a fatality rate of 9.6%.
And the MERS virus, which was in 2012, had 2,494 cases and had 858 deaths, with a fatality rate of 34%.
Oh my gosh, that's a lot.
Yes.
And the Ebola virus, which was in 2014, had 28,639 cases and 11,316 deaths, with a fatality rate of 40%.
Gosh, that is scary, isn't it? Now, symptoms. What about the symptoms of someone who might have coronavirus?
Some are asymptomatic and do not have any symptoms whatsoever.
And people who might have symptoms, they might develop fever,
Cough,
shortness of breath,
pneumonia,
and some people who are acutely unwell or critically unwell might develop acute respiratory distress syndrome and also septic shock, which might be the cause of death.
who are at major risk from coronavirus.
Well, the elderly, especially people more than 60 or 70 years of age, are at high risk. Also,
Smokers,
and people with comorbid conditions such as diabetes, asthma, COPD, or heart diseases.
how does it spread?
Well, the incubation period of this virus is 5 days to 14 days, which means people might not have any symptoms for this period. But then, after this period, people might start,
Coughing and sneezing,
which is spread by
droplets.
infection, yes, and also contaminated hands and
T-zone,
which is.
eyes, nose, and mouth.
So we need to keep our hands away from the.
T-zone.
That's right.
How is it tested?
It's tested by sputum and aspirate swabs as well as blood tests.
How do we manage and treat coronavirus?
Well, predominantly the management is supportive, which means like any other flu virus, we need to manage them very, very supportively. Keep people at home when they are not very unwell. People who might be hospitalized may need
IV fluids.
oxygen and ventilatory support.
Are there any antiviral medicines available?
Well, there is a lot of research and clinical trials ongoing, and so far, chloroquine, ritonavir, and remdesivir has been shown some positive results.
Are there any vaccines?
Vaccines are still in the developmental phase. It might take at least a few months to a few years until we have full-blown vaccines available to protect us from the coronavirus.
What about the prevention?
This is the key. Prevention is the key to avoid the coronavirus. So what do we do for this?
Well,
Isolate individuals, keep away people who might have the coronavirus.
keep at least 3 feet or 1 meter away.
The virus can survive on surfaces for over 24 hours. Hence, we need to be careful and disinfect all contaminated areas and surfaces.
Avoid travel to outbreak areas.
Stay at home.
And stay away from crowds.
That's right. What about hand washing?
Wash for at least 20 seconds with soap and water. Don't forget to wash between the hands, at the back of the hands, on your thumbs, and on the edge of your nails.
That's right. That is really, really important. Hand washing is really, really the key. Yes?
Yeah.
Also, people need to cover your coughs and sneezes. Try and use a tissue where you can. Catch it, bin it, and kill it. Or if you do not have a tissue at hand, use the crook of your flexed elbow to cough or sneeze. What about surgical masks?
Surgical masks is recommended only for those with flu-like symptoms and not for everyone.
That's right. And avoid touching the...
T-zone, the eyes, nose and mouth.
That's right. Protective equipment is only reserved and needed or recommended for healthcare workers. So the take-home message for us all is
prevention is better than cure.
be safe
Take proper precautions
and let's fight Corona together.